This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue
As
opposed to
second.
health first.
Medical Dilemma.
Hi, I'm Sonny Rosario, and you're watching Medical Dilemma. Stroke is a leading cause of disability and the second leading cause of death in the Philippines. Ischemic stroke makes up 70% of reported cases, while hemorrhagic stroke comprises the remaining 30%. Studies show that stroke risk factors remain largely unmanaged among Filipinos. Thus, a further significant rise in stroke cases isn't a remote possibility. For this episode dedicated to stopping stroke, we have Dr. Perry Noble, a specialist in neurology, connected with the Makati Medical Center as the Vice Chairman of the Department of Neuroscience. He also teaches at the San Beda College of Medicine. Welcome to the show, Dr. Noble.
Thank you. It's nice for you to invite me, being a neurologist, and of course timely because we'll be talking about stroke.
Yes, well, Dr. Noble, for the purpose of our audience understanding, could you describe what the nature of stroke is?
Okay, you know, your introduction is quite good, so it gave me a good idea where to start. When we mean stroke, well, we can define it and divide it into three, what do you call this, defining statements. What is a stroke? A stroke is a stroke if it is of sudden onset. Remember?
It is sudden onset.
Sudden onset.
That's the first
So
statement.
actually, it's a sudden onset of neuro deficit. What is neurologic deficit? Meaning, the most common that we encounter is weakness, which is weakness of the motor function of the individual. And actually, that is the most common, but it may present, as we say, neurologic deficit, anything that our body is capable of doing, like even language, speaking, or even numbness. So there's a sensory deficit, it may come to that. Or even sudden loss of balance. Okay?
Sudden loss of balance.
So anything that may come, any symptom, so whether it be numbness, weakness, or difficulty of speech, or even vision or hearing, that comes suddenly may be of that of stroke. Now, what further defines it, this is the third statement, that it is of vascular cause.
It is a
What-
vascular.
Vascular cause, meaning we invoke any, the blood vessels that may be responsible for this. And you have explained, you have mentioned a while ago that there are two types of stroke, that is of ischemia and hemorrhage. So either there is a block in the blood vessel, okay, may bara, or the other thing is hemorrhage, wherein the blood vessel somehow burst. Okay. Okay. So that is a stroke. Many years ago, people think of stroke as being due to the heart, but it's due to the brain. Okay.
Yes. Well, I think most people still believe that. The
Yes,
stroke
of
is
course.
connected to a
Yeah.
heart condition.
Okay. And can I proceed? And you said that stopping stroke, that is quite difficult to say. Maybe more appropriate word would be how to prevent it.
Preventing stroke.
Preventing stroke. So in any patient, the vascular, it's due to vascular event. So anything that makes our blood vessel unstable would cause stroke. And that's why one of the primary causes, or I may say the primary cause of stroke, is that of hypertension.
Hypertension.
So we deem this as the precipitating factors. Hypertension, other illnesses or conditions that may provoke or precipitate a patient, an individual to having stroke is diabetes, of course, high cholesterol or high fat, body constitution, malaki, obese, okay? And then we cannot deny our genes. If there's a family history of a stroke in the family, that makes one predisposed to having stroke as well.
Okay, so
Then
these are the risk factors.
There are others, no? Smoking,
Smoking.
vices that we know, drinking,
Drinking.
okay? And there are other minor, but this I would say are the major things that we ask a patient or the family if the patient would come to us of this presentation, a sudden onset of neurologic deficit, okay?
I see. So these factors that you mentioned, they cause some sort of block in some cases.
Okay,
Or,
there is an interplay. Sometimes we cannot invoke one factor being the major cause of the stroke. In fact, some patients would come to us, how come I suffered from stroke? I'm not hypertensive.
Yes.
But of course, he comes in very heavy,
Very heavy.
no exercise, and seems to be stressed at work. So we try to factor in all of these things. So this may be the ones responsible for a patient suffering from stroke. But as I mentioned, blood pressure control is very important in terms of preventing stroke. And I may say that this is also one of our aim is to control the blood pressure if a patient came in from stroke, because they usually come to us with very high blood pressures at the ER or even in our outpatient department.
I see. Now, these blockages that happen, or these veins that, arteries that burst, I suppose they're caused by certain physical elements inside?
Yeah, of course.
And what are these materials made of?
Usually, there's a block or either the burst. And things that may contribute to this is, of course, high cholesterol.
The
okay?
cholesterol.
The cholesterol. And of course, the stature, the state of the blood vessels themselves, meaning uncontrolled blood pressure makes them really somehow friable. If there's already a laid down cholesterol there, it may cause it to bleed or even to have a block further. So not only that, good vascularity or improved blood supply may be enhanced by good exercise, good diet. So if the patient does not do this, or it's not part of his regular armamentarium, definitely is prone to this. Okay.
I see.
So what are, if it's hard to answer, but there are many elements that may cause it. But what is important is that you, in order to maintain a healthy lifestyle, preventing stroke, excuse me, we have to have a checklist of whether you do these things. So diet, exercise, maintenance of good blood pressure, maintenance of good cholesterol and sugar, and then of course avoidance of vices that may be contributory to this.
I see. Okay, thank you so much, Dr. Noble, for the basic information. We'll take a break at this point, and we'll come back after a few words from our sponsors. Thank you so much, sir.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other senses, right? So you hear it, you see it, and then you can smell the fireworks.
can inspire and words can destroy. Choose yours. Okay?